Hi everyone, Alexis and I are presenting about alcohol problems in couple therapy.
Hi, and I am going to minimize our faces for the rest of the presentation just so we're not blocking out any text, but I know you'll miss us, but here we go. Okay, so to start off, we're going to talk about the alcoholic couple. I'm not sure how I feel about this phrase, but it's one that was used in this chapter in Gurman in the book. And basically, the term alcoholic couple refers to couples in which one or both members have an alcohol problem. MacKenzie and I have spent a good bit of time discussing how we feel about the term alcohol problem, which was also used a bit in the book and in other readings that we found. And while it's not our favorite, it might get used throughout this presentation, but some other ones that might get thrown around are alcohol dependency or alcohol use disorder. And the reason why we're using alcohol problem, or why the books have, is because couples or a partner in a relationship may come to therapy and there might not be a specific diagnosis of alcohol use disorder, but they still may find the alcohol use a problem. So just wanted to put that out there. So the alcoholic couple refers to couples where one or both may have an issue. And why this is important and why we chose to talk about it is because alcohol consumption and relationships are very interconnected, and because we're marriage and family therapists, really working with this particular issue really takes on a systemic perspective. So there are high levels of, or a lot of studies that show high levels of dissatisfaction and relational issues due to drinking or alcohol use, high alcohol use. One reason that is frequently found in studies is that drinking can have some positive, or lead to some positive interactions when drinking, especially early on in relationships. Like, it may be easier to feel more comfortable having sex, or conversations can be more fluid. Like, that's definitely something I have experienced in relationships, where early on we go on lots of dates and drink a lot because it helps people open up. But that can also lead to overcompensating in relationships, or not people not having sex without being drunk, and all of these things can also lead to alcohol use disorder. One thing that we also wanted to note is that this chapter in the book and a lot of research is mainly focused on heterosexual couples. MacKenzie found a cool article that we're going to talk about later on about LGBTQ couples, but in the book they focused on heterosexual couples, and they noted some specific different gender patterns that are found. For example, episodic drinking leads to less negative interactions. That's not specific to gender patterns, but messed up my notes. Yes, so going back to gender patterns, there have been things that have found that men with alcohol use disorder show avoidance or lack of responsibility for relationship issues, whereas women with alcohol use disorder show more like male demand and female withdrawal patterns, which I thought was kind of interesting. And so going back to what I was just talking about, there are some drinking, personality, and communication issues are all highly linked with this issue. So, for example, different relationship impacts, like I was saying, there's episodic drinking leading to less negative interactions, meaning like if they're just infrequent, or like one night a month of really heavy drinking, there's less negative interactions. But if there's like steady or consistent drinking, that leads to more negative communication, more interrelational issues. I also noted that there's personality is a factor when it comes to alcoholic couples. For example, if a partner has more antisocial characteristics, they've been shown to have more hostile interactions with drinking. And then a final piece is that increase in alcohol use has been shown to have a decrease in sexual satisfaction for one or both members of the couple or the relationship. And that could be for a lot of different reasons. There could be people just losing interest because they don't want to sleep with someone who's drunk all the time. There could be biological issues where chronic drinking can lead to the inability to have an erection consistently. Lots of different things. And some stuff that is not on the slide, but we're going to talk about a little bit more, is there is an increase in interpersonal violence with alcohol use disorder. And this has been shown to be regardless of the gender of the person with alcohol use disorder. Okay, so some things about the role of the therapist. When working with couples with alcohol problems, the therapist usually takes an expert stance. In the book, they didn't talk specific about theoretical approaches, but they did talk about how with this specific issue, therapists take on the role of the expert because people are looking for a more directive approach. What I think is really interesting is that the therapist really is very adaptive with this particular issue. They need to kind of adjust their role based on the different stages of change. And so if you're not familiar with the stages of change, those are pre-contemplative, that's kind of like problem, what problem? I don't have a problem. And in that position, the therapist kind of starts off as a listener and encouraging. The next stage of change is contemplation. And I kind of think of that as like, oh, maybe I have a problem. I don't know. And so that's where, again, there's lots of encouragement from the therapist, but they're taking on a little bit of a teacher role, starting to plant some seeds of doubt, doing things like decision matrix or list making, things like that. And the third phase is determination or preparation. And that is kind of like, I have a problem, I just don't know what to do, I need your help. And so in that role, the therapist is a bit more directive, but giving lots of homework, lots of role playing, just things like that. The next phase is action, and that is like they're working on their plan. So the therapist then is the consultant. They're practicing skills in session, lots of homework in this stage. And then finally, there's maintenance. And this is typically the person who's in the maintenance stage has been like actively working on their plan, maintaining abstinence if that is their goal for 6 months or more. And at this phase, the therapist is like less directive and kind of stepping back and looking for more directiveness from the identified patient or the client. And then finally, there is another stage. I know I said finally twice, but this one does not always happen, but is definitely a reality, is relapse. And so it's really important for the therapist to prepare both members of the couple for this possibility and to have plans in place. So some other things that are interesting, like I said, the therapist is always evolving their role. But this was a little shocking to me that, and I don't know why it's shocking, but the therapist really needs to take an effort to ally with the identified patient. And that's what IP stands for. If you'll see that in the rest of the book or rest of the slides. And SO stands for significant other. And so one of the reasons that the therapist needs to ally with the identified patient, even though it may really trigger the therapist or kind of go against, their values or et cetera, it might be hard for them if that client is really acting out or behaving in ways that really, are not the best, is to help them kind of plant those seeds of change and build an alliance with them. So the role of the therapist with alcohol use disorder is really creating a working alliance, but primarily with the IP. And so some implications for therapists working with couples with alcohol problems. Countertransference is found to be more common with this particular issue. Alcohol use disorder is very common in the United States, and therefore a lot of therapists may have personal experience with this. They may have parents who had alcohol dependency issues, a lot of those things. So that's why supervision and consultation is particularly important in working with couples with alcohol use disorder. Some other things that, like I said, the necessity of allying with the identified patient to build trust and relationship could be quite challenging depending on behavioral issues, and also understanding the impact of the significant other. Resistance to change and non-compliance are also, you know, a pretty big reality of working with couples with alcohol use disorder. And so being able to be adaptable, like I was mentioning previously, understanding the stages of change and what your role is really important, because it could be really frustrating as a therapist when there is a client that's so resistant and non-compliant. And comorbidity with other substance abuse disorders or psychiatric conditions is very common. There is a statistic for comorbidity with multiple drug use is 50% for males and 40% for females with other drug use. Abstinence from alcohol could also lead to like trying out other substances that they might not have before. So it's really important to continue to like check in on this. They recommend careful evaluation and addressing all drugs of abuse, not just one that the partner dislikes. So for example, a partner might not have an issue with someone using Coke every once in a while, but the drinking is a problem. And so it's really important to kind of assess all of that. And then also consideration of different cultural backgrounds and rituals, traditions, etc., need to be taken into account. It's really beneficial to consider family of origin structure and understanding, like I was saying, with traditions, like there might be some cultures where there's a lot of drinking on holidays, or families that don't see drinking as an issue. So really taking all of those things into account is really important.
Okay, so when a therapist is completing the initial assessment for a couple with alcohol dependency, the most important goals are identifying the couple's most urgent needs and deciding how serious the alcohol problem is. And this all comes from alcohol behavioral couple therapy, which was the treatment that was mainly discussed in the book. So if the alcoholism is too serious and withdrawal symptoms will be severe or even dangerous, a detox program might be necessary, or some type of medical intervention before actually completing therapy, because some couples are able to just completely stop drinking and maintain their withdrawal symptoms, but others it will be more dangerous depending on how severe the problem is. Also, a history of drinking, what leads to drinking behaviors, the costs and benefits of drinking, aspects of the couple's relationship that are related and unrelated to drinking behaviors are all assessed in the initial assessment. Intimate partner violence is assessed, but this is especially, did it freeze? Sorry.
No, that was my fault. Sorry.
Okay. So yeah, assessing intimate partner violence is especially important for alcoholic couples because they are even higher risk for intimate partner violence. Next slide. Thanks. So the overall structure of alcohol behavior couples therapy consists of assessment followed by psychoeducation and then a lot of skills training. So at the beginning of every session, the identified patient is breathalyzed, because if they're under the influence at all, they might not be able to participate in treatment to their full ability, and it might not be as effective. Early sessions of ABCT involve psychoeducation about alcoholism, including the risks, the effects, and how to change away from the drinking behaviors. Another important piece of this treatment program is self-recording cards, and those are a homework assignment that couples complete between each session. And basically, the identified patient tracks their own drinking, their drinking urges, and their relational satisfaction. And the significant other does the same from his or her own perspective of the IP's drinking. So, what the significant other thinks the patient has been drinking, or how many urges they've had, even if they haven't drank. So in the session, after the patient is breathalyzed, they review the self-recording cards, and the session mostly consists of the couple learning new behavioral skills to actively solve problems related to drinking or their relationship. And these skills that are learned are especially aimed at identifying high-risk drinking situations that may come up between sessions and how to decrease the risk of drinking, because the main goal is abstinence. So as the therapy sessions progress, goals are created between the couple and the therapist. They work together to create them. And these goals definitely include abstinence. That's a major, it's almost required in ABCT. Dependency in a couple. Another goal is to find coping skills for abstinence and for non-alcohol related problems in a relationship. Another goal is couples aiming to improve just general relationship functioning, such as problem solving and communication. And then dealing with relapses, because they are so common, it's important to know what to do when that happens. And then finally, as treatment continues to progress, termination is addressed between the couple and the therapist. They try to identify signs of potential relapse and be prepared to respond. This may include booster sessions, and they also create a relapse contract. So one member of the couple can, or each member of the couple can have place things in place to work together with in case they see signs of relapse. Next slide. For mechanisms of change, there are they kind of target 3 areas. So for targeting the patient, you want to increase the patient's ability to recognize high-risk situations and increase the patient's confidence in their ability to handle those situations. Therapist also wants to help the partner understand behaviors that enable the patient's drinking and create coping skills to deal with responding to drinking in high-risk situations. And as a couple together, the best mechanisms of change are seen from helping the couple as a unit experience more positive and less negative interactions and better communication. So when those factors are all targeted, the most change is seen in research. And overall research shows good outcomes for drinking and for relationship functioning for couples undergoing ABCT. In the book, it identified couples who have at least a high school diploma, being employed, living together, having a serious long-term drinking problem, having an older identified patient, having abstinence been achieved in the past, and having alcohol cause legal problems before, all most benefiting from ABCT. So couples with those characteristics have the most benefits coming from this treatment. In a 2004 study found directional evidence that improvements in the relationship are followed by decreases in drinking behaviors, rather than the opposite, where less drinking leads to better relationships. That side has weaker evidence. And this is interesting to me because ABCT focuses on alcohol at the start of the treatment, and abstaining is the first goal. And then that is followed with improving relationship functioning, when the research shows that the opposite might be the direction that is more effective. And ABCT also leads to decreases in domestic violence, and this is due both to increased relationship functioning and decreases in drinking. Next. So in terms of interventions used in the sessions. Targets of interventions are the patient's drinking, which includes maintaining what maintains the drinking, what motivates the drinking, and what triggers the drinking. Another target is the partner's response to the drinking, including how the partner copes, what triggers the identified patient that is influenced by the partner, how the partner might reinforce the patient, and the consequences for the patient that come from the partner. And the third target of the interventions are the couple as a unit, which include their collaboration, their support for each other, their communication, and the quality of their relationship. A couple examples of interventions that were pretty prevalent in the book was self-management planning and the drinking chain. So first, self-management planning is there to help the identified patient develop coping strategies when faced with a high-risk environment. And then the drinking chain is another intervention that's aimed to help the identified patient identify high-risk situations and co-occurring thoughts that lead to a behavior with positive and negative outcomes. So some of the info used in the drinking chain in creating that might come from the self-recording cards that I talked about earlier. And once the couple and the therapist together identify these triggers, these thought processes, and the consequences, the therapist can help the identified patient learn coping skills and use self-management planning to maintain abstinence. So I took this example that's in the picture on the slide right from the book. It's on page 578 if you want to look at it in the book. So in the case study in the book, there's a couple, Bob and Heidi. Heidi was the identified patient and Bob was the significant other. He also had an alcohol problem, but Heidi's was more severe. And so this is her drinking chain that was created. And one of her triggers was being home with the kids in the late afternoon when Bob was still at work. And her thoughts and feelings in regards to drinking were that Bob wouldn't be home until 11, so she had plenty of time to drink and relax. And so with those thoughts in mind, she ended up drinking 3 glasses of wine in a 3-hour period, and she experienced positive and negative consequences. And you can see there's a lot more negative consequences than positive. So she ended up drinking more than she intended. Her husband was upset. She didn't hear her child cry. And yeah, she was able to relax and enjoy drinking. But I think that the negative consequences, especially laid out in front of her, kind of outweighed the positive. So that was an unsuccessful example of her trying to abstain. And then I have an example of a successful drinking chain on the next slide. You want to switch it?
Yep. Mm-hmm.
Thank you. I don't think it switched. Oh, it did. Sorry. So another event that happened was at another trigger for Heidi was open bar events that are, sorry, meant to say event, not even, that are sponsored by her husband's company. So when thinking about drinking or not drinking, she thought that everyone was drinking except for her and she wanted to have fun as well. But she also didn't want to embarrass her husband, so she decided to stick with it. She said she could do it. And so instead of drinking alcohol, the behavior was that she drank seltzer with lime and she ate lots of food to avoid drinking. And then here, there's a lot more positive consequences than negative consequences. She was proud of herself and she found it unappealing to watch others get drunk. And she was clear-headed the next day, not hungover, and her husband was proud of her. And the negative consequences that she missed the high feeling. But still, there was a lot more positive consequences when she was successful and a lot more negative consequences when she was unsuccessful. So that's what's important in identifying in that intervention. And the next slide.
Okay, so we've talked about some of these things throughout the presentation, but some social justice issues or different perspectives that came up and that we discussed was a common treatment tool is the use of a breathalyzer, and that while effective and many people do like it, it could also be perceived as invasive and can negatively affect rapport building. One example that I have from my work right now is a client that I have that chose to have an ankle monitor that like a scram bracelet that detects alcohol with her probation officer. And though she was the one that requested it, over time she began to feel like it was really invasive in her life, and she started to feel like a lack of trust with her probation officer. And while I recognize that that's a different relationship, I think that it is something that could happen within a therapeutic setting, that you could start feeling like, okay, I've been doing well, I'm showing you all of these positive things that I'm doing, and you still don't trust that I'm being honest, or feel that like it's another invasive technique that's being used. You're already sharing all of these things about your life, and that's just another one. So that could be something that could come up. Another issue is that the therapist role in this, with couples with alcohol use or alcohol dependency, is the stance of an expert. So they're taking a non-collaborative approach, which might be seen as, offensive, or not really the style that works best with particular clients. So it's not as inclusive as other models could be. Another issue is there's client relapse, and some questions that came up in a lot of the readings is this because of the brief nature of treatment? Many treatments are reduced down to 12 sessions, so are we doing a disservice to clients because of the high rate of relapse? Is there a better way to work with different clients? A positive thing is that the harm reduction model is really increasing in its use. And if you're not familiar with harm reduction, this is a way to kind of move away from the abstinence-only model. And harm reduction is used in a lot of different fields, like the use of the seatbelt is harm reduction. So driving a car is inherently dangerous, and having a seatbelt is reducing the potential for harm when you get in an accident. Other forms of harm reduction are like safe needle disposals or things like that. And in the case of alcohol use, harm reduction could be trimming down from a case of beer a night to 12 beers a night, and kind of, addressing that quitting cold turkey is not all that effective for many people. So harm reduction really works within adapting to client needs, which I think is pretty awesome.
And in an article I found about LGBTQ issues with ABCT, I found that basically, similar to straight couples, if a gay or lesbian couple with an alcohol use disorder is treated, they have better drinking and relationship outcomes after they complete ABCT compared to just receiving individual treatment. So that's the similar results that what straight couples would see in research. So treating an alcoholic person in a couple setting shows better outcomes than treating that patient individually. So kind of shows that there's some research heading towards other populations. So.
And how are we doing on time?
We are at 28, almost 29.
Awesome. Okay.
So for our experiential activity, we used a case study that was an art therapy exercise. And the client in this case study was experiencing some issues with temptations, and she successfully overcame a temptation. She didn't drink, but in therapy, she felt as though for it to be successful, the temptations needed to completely cease. So in addressing that, the therapist came up with this exercise, which was to create a timeline or pathway to recovery. And you can see here that they can have a start or an end, and it might have different time frames where this client had a 1-year goal. And it also shows stability. You can see with the colors and with the lines and spots how this patient didn't really see the journey as being a stable one, and she was struggling with temptation. And so after the art portion was finished, the therapist use psychoeducation to kind of tell the client, like, this is normal to have temptations, and inform the client that there's a lot of stresses involved with abstinence, and there's a lot of potential for relapse. And then the therapist will also reinforce skills for success. And it shows that temptations are okay because success isn't easy or a stable process. The therapist might also ask the client about their opinions of the process, the whole process of abstinence, and the therapist can inform whether they're correct about their opinions. And in terms of couples, the couples can each make their own timeline and compare them, or they can make one together. And Alexis made her own timeline. We're going to go through that.
Okay, so just wanted to show you some of the what word am I looking for? The art resources that you might want to use if you were to do this activity. So this was some stuff. I'm not the best artist, so collaging is a lot easier for me, which might be the case for many people if they feel like overwhelmed by having to paint or draw, or like getting a paintbrush in their hand, they might just feel totally lost. So for me, I just had like a bunch of magazine cutouts and random stuff I found around my house and just put it on a table, and it was a lot easier for me to start getting after it. And so I did this activity while thinking about a past relationship I had, and kind of tried to put myself in that mindset of how I was feeling. My ex-boyfriend struggled with alcohol use and substance abuse, and unfortunately I did not go to therapy when I was in that relationship, but did afterwards. And so I used some of what we talked about in those sessions, and kind of like years after it, reflecting on how I was feeling in the beginning and what I was hoping for at the end. And I think this could have been a really cool thing to do while I was in that relationship, so I could have had a way to share my feelings with him. But so instead of saying start and beginning, I kind of shared how I was feeling at the moment. So I was feeling a lot of turmoil and chaos and some hope. And that was definitely like kind of a cycle of feeling of those. And I don't know what these kids are doing in the bottom of the screen, but that's what something about that stood out to me, and feeling like I was kind of drowning and lost. And so that's what some of those pieces were reflecting. And then this is kind of just some images of while I was doing it. I had music on. It was really fun. I started to think about like what would have been helpful for me to get through that path. That's kind of cheesy, but what would have been helpful to get through what I needed in that relationship, and to share what was impacting me. So that's kind of what I focused on for the rest of it. And I have some pictures of it, like in the beginning, feeling turmoil, chaos, and hope, but hoping for continued hope, cohesion, fun, and love. And, you know, feeling some of those darker feelings of fear and being lost. But then like doing things that us as a couple really enjoyed. Like we really liked being outside together and cooking, and the little cupcake in the bottom corner was kind of my hope for like some anniversaries with each other. The top is a bowl of condoms and coffee. So, you know, it made me think of like going back to like what our sex life was like in the beginning of our relationship. And this is my final product. Not as good as the first woman's, I think, but music was something that really brought us together. So I used that as my visual of like what the timeline was like for me, or what I hope the timeline would be like for me. And so, I don't know, I really enjoyed doing it. I think that this is something that could be really helpful for someone that has a hard time expressing their feelings or hopes with words, like I certainly do. And it would have been really awesome to do this as a couple, to share the impact, or for the person with alcohol use disorder or dependency to be able to share what their experience and what their goals are. So I think it can be used in a lot of different ways, but I had a lot of fun doing it. So Yeah. That is our presentation. MacKenzie, do you have anything else that you want to share?
I don't.
Okay, well, thank you all so much. And if you have any questions, we're going to post a handout that we made. We're going to attach that in the folder in the Google Drive, but we can also send an email to make sure everyone gets it. And we'll be posting the video as well. But thank you all so much.
And when we post the video, we're going to make a Google Doc for people to comment on if you have any questions or comments, because I think that's required. And since we don't have the Sakai up yet, we can use the Google Doc to communicate.
Yep. All right, everyone. Thank you.